Top 5 common medications that can damage your liver instantly. Have you ever considered that some of the medications you take every day might be quietly harming your liver? It's surprising, but true. The pills you trust to help with everything from pain relief to managing chronic conditions, or even something as simple as a cold, could actually be putting your liver at serious risk. Your liver is one of the most important organs in your body, responsible for detoxifying your blood, producing crucial proteins and processing the nutrients you need to stay healthy. But imagine what happens when this vital organ is constantly bombarded by medications that might be more harmful than helpful. In today's video, we're going to uncover the shocking truth about the top 5 common medications that could cause severe liver damage, sometimes almost instantly. This is information you won't want to miss, as it could make a huge difference to your health. Before we dive into the medications that could be harming your liver, it's important to know how to recognize when your liver might be in trouble. Your liver sends out distress signals when it's struggling, and some of the most common symptoms include feeling constantly fatigued, even after a good night's sleep. You might also notice a yellowing of your skin and eyes, known as jaundice, which happens when your liver can't process bilirubin properly. Pain or discomfort in the upper right side of your abdomen, dark urine, and constant nausea or vomiting are other signs that your liver isn't functioning as it should. If any of these symptoms sound familiar, it's crucial to consult a healthcare professional immediately. Ignoring these signs could lead to more serious health problems down the road. Now that we've covered the warning signs, let's get into the top 5 common medications that could be damaging your liver. 5. Statins. Statins are a class of drugs commonly prescribed to lower cholesterol levels and reduce the risk of cardiovascular diseases such as heart attacks and strokes. They work by blocking an enzyme in the liver that's necessary for making cholesterol. While statins are incredibly effective at lowering LDL, bad cholesterol, and have been life-saving for many, they come with potential risks that are often overlooked. One of the primary concerns with statins is their impact on liver function. The liver is the organ responsible for metabolizing these drugs, and in some individuals, this process can lead to liver inflammation. This inflammation is typically indicated by elevated levels of liver enzymes in the blood, which can be detected through routine blood tests. For most people, this enzyme elevation is mild and temporary, but in rare cases, it can progress to more serious liver injury. Symptoms of liver damage from statins might include fatigue, weakness, loss of appetite, upper abdominal pain, dark-colored urine or jaundice, yellowing of the skin and eyes. It's crucial for anyone taking statins to have their liver function monitored regularly by their healthcare provider, especially if they have other risk factors for liver disease. If you're experiencing any of these symptoms or have concerns about your liver health while taking statins, it's important to consult your doctor immediately. They might adjust your dosage or explore alternative treatments to protect your liver while still managing your cholesterol levels effectively. For NSAIDs, Nonsteroidal Anti-Inflammatory Drugs, NSAIDs are among the most commonly used medications worldwide, often available over the counter, and are used to relieve pain, reduce inflammation, and lower fevers. Popular NSAIDs include ibuprofen, Advil, Motrin, naproxen, Aleve, and aspirin. These drugs are staples in many households, relied upon to manage everything from headaches to arthritis pain. However, what many people don't realize is that regular or high-dose use of NSAIDs can have significant repercussions for liver health. The liver metabolizes NSAIDs, and in the process, these drugs can cause oxidative stress and inflammation within the liver cells. This can lead to a condition known as drug-induced liver injury, DILI. In most cases, liver damage from NSAIDs is mild and reversible once the medication is stopped. However, in some cases, especially with prolonged use or in individuals with pre-existing liver conditions, the damage can be more severe, potentially leading to hepatitis or even liver failure. The risk of liver damage is higher when NSAIDs are taken in higher doses than recommended, or when combined with other medications that also strain the liver, such as alcohol or certain prescription drugs. To minimize these risks, it's essential to use NSAIDs only as directed and to avoid long-term or high-dose use without medical supervision. If you find yourself needing pain relief frequently, it might be worth discussing alternative treatments with your healthcare provider. They can help you find safer options that won't put your liver at risk, especially if you have other underlying health conditions that might make you more susceptible to liver damage. 3. Paracetamol, acetaminophen. Paracetamol, also known as acetaminophen, is one of the most widely used over-the-counter pain relievers and fever reducers. It's found in many household medicine cabinets, often as a go-to remedy for headaches, muscle aches, colds, and flu. Paracetamol is favored for its effectiveness and relatively few side effects when taken at the recommended dosage. However, what many people don't realize is that paracetamol is also one of the leading causes of acute liver failure worldwide. The danger arises when paracetamol is taken in higher doses than recommended or over a prolonged period. The liver processes paracetamol, breaking it down into metabolites. While most of these metabolites are harmless, a small portion is converted into a toxic compound known as NAPQI, N-acetyl-P-benzoquinone. In normal doses, the liver can neutralize NAPQI using a substance called glutathione. However, when the dose is too high, or if the liver is already compromised, the glutathione stores can be depleted, leading to liver cell damage. This is particularly risky for individuals who might unknowingly exceed the safe dosage by taking multiple medications containing paracetamol, such as cold and flu remedies alongside painkillers, or by consuming alcohol, which further stresses the liver. The symptoms of paracetamol-induced liver damage can be subtle at first, often presenting as nausea, vomiting, loss of appetite, and general malaise. However, within 24 to 72 hours, more serious symptoms such as jaundice, confusion, and bleeding tendencies may develop, signaling severe liver injury. To protect your liver, it's essential to adhere strictly to the dosage instructions on paracetamol packaging, and to be aware of other medications you may be taking that also contain this drug. If you suspect an overdose or if you experience symptoms of liver damage, seek medical attention immediately, as early intervention is critical in preventing permanent damage. 2. Antibiotics. Antibiotics are powerful medications used to treat bacterial infections, and they've saved countless lives since their discovery. However, while they are effective at eradicating harmful bacteria, some antibiotics can have unintended side effects, including liver toxicity. The liver plays a crucial role in processing and detoxifying the drugs we take, and certain antibiotics can overwhelm this process, leading to liver injury. Among the antibiotics most commonly associated with liver damage are those in the penicillin class, such as amoxicillin clavulanate, as well as others like tetracyclines, sulfonamides, and fluoroquinolones. The risk of liver injury from antibiotics is generally higher in individuals who take these medications for extended periods at high doses or who have pre-existing liver conditions. Symptoms of antibiotic-induced liver damage can range from mild elevations in liver enzymes, which are usually asymptomatic, to more severe reactions such as jaundice, itching, dark urine, and abdominal pain. In some cases, the liver injury can be severe enough to cause acute liver failure, a life-threatening condition that requires immediate medical attention. The key to minimizing these risks is to use antibiotics only when absolutely necessary and to follow your healthcare provider's instructions precisely. Overuse or misuse of antibiotics not only increases the risk of liver damage, but also contributes to the growing problem of antibiotic resistance, which can make infections harder to treat in the future. If you're prescribed antibiotics, especially for long-term use, it's important to have regular checkups to monitor your liver function. If you notice any signs of liver distress while taking antibiotics, contact your doctor right away. They may need to adjust your treatment plan or switch you to a different medication that's less taxing on your liver. 1. Herbal and dietary supplements. You might be surprised to see herbal and dietary supplements at the top of this list, but they are in fact one of the most common causes of liver damage. Unlike prescription medications, which are rigorously tested and regulated, supplements are not held to the same stringent standards. This lack of regulation means that supplements can sometimes contain harmful substances, be contaminated with toxins, or be taken in dosages that are not safe. Herbal supplements like kava, green tea extract, and certain weight loss products have been particularly associated with liver toxicity. Kava, for instance, has been linked to cases of severe liver injury, including hepatitis, cirrhosis, and even liver failure. Green tea extract, when consumed in large amounts or in concentrated form, can also cause liver damage, as can certain weight loss supplements that may contain undisclosed or dangerous ingredients. One of the biggest dangers with supplements is that they are often perceived as natural and therefore safe, but this is not always the case. The liver, being the body's detoxification center, can be overwhelmed by the compounds in these supplements, leading to inflammation, scarring, and in severe cases, liver failure. Symptoms of liver damage from supplements may include fatigue, nausea, abdominal pain, jaundice, and dark urine. To protect your liver, it's crucial to approach supplements with caution. Always consult your healthcare provider before starting any new supplement, especially if you're taking other medications or have pre-existing health conditions. It's also important to stick to reputable brands and avoid taking more than the recommended dose. Remember, just because something is sold over the counter or marketed as natural doesn't mean it's safe. Your liver's health is paramount, and being informed about what you're putting into your body is the best way to protect it. So, there you have it, the top 5 common medications that can potentially harm your liver. It's surprising to think that something as routine as taking a pain reliever or managing a chronic condition could have such serious side effects, but now you're armed with the knowledge to protect yourself. Remember, your liver is crucial for your overall health, and being aware of these risks is the first step in keeping it safe. If you're currently using any of these medications, it might be time to reassess your options with your healthcare provider. Thank you for watching. If this video helped you, please give it a thumbs up and share it with anyone who could benefit from this information. And if you haven't already, make sure to subscribe to Healthy Vitality for more insights on how to live a healthier, more vibrant life. Take care of your liver, and it will take care of you. Until next time, stay healthy and stay informed.